All right, we're rolling. I've got the one and only Lee Cantrell, Chief Growth Officer of Gold Kidney Health Plans. Did I get that right?
You got it. You got it.
All right.
Gold Kidney Health Plan. I love it.
It's a mouthful to do all that at once. So, Lee, thank you very much for being with me today. You and I had been talking about jamming on C-SNPs in general, and then, Gold Kidney and your role in the company and where you guys are headed. But before we do all that, you are an interesting cat, and I want to talk a little bit about you, if that's okay. So our people that are watching this at home can get a good feel about who Lee is. So I know you're from Georgia. Can you talk about that?
Yeah. So born and raised in Georgia. They can't get rid of me down here. Live just north of Atlanta. The great thing about Atlanta, though, is I can get anywhere in the country, right, with one direct flight. So yeah, born and raised here. A lot of people in the industry know me because of my golf skills. So
Yes.
I grew up a golfer and went to Furman University on a golf scholarship and graduated from there and had some amazing opportunities to play golf in some awesome places. Got to play a little professionally before I decided I needed to hang up the clubs and actually make a living.
Awesome. Where was your favorite place to play?
Oh gosh, I played so many amazing courses. The Arizona courses are beautiful, but I have to say the course I grew up on is probably one that holds the dearest place in my heart because it's the Atlanta Athletic Club. And if you know anything about the history of that, Bobby Jones was a member. Really, really steeped in a ton of golf history. So I didn't realize how fortunate I was to grow up in a place like that.
It's outstanding. Awesome. You got kids. Talk a little bit about the kids.
Yeah. Of course. I would be remiss to miss out on Turner is our 6-year-old. And that's my maiden name. So we try to keep all the family names there in the picture. He's just started first grade actually this week.
Amazing.
So it's been a crazy week for us. And thankfully I have a super, super supportive husband here that does a great job of helping me hold down the home front as I travel. And he has been awesome. And he gets to hear me talk about insurance all the time to the point that he got his license because he's like, all right, if I'm going to hear about this, I want to understand it. So
Smart guy.
That was a good result of COVID and time home.
Awesome. I also have a 6-year-old, and so we're starting school the same way. So I feel the weirdness, the changing of the guards, if you will. So
yes.
But talking business, we are both recovering insurance agents, I would say, and you've grown into your role. You've joined Gold Kidney, and it's a unique name, unique company, and you guys have entered into Arizona and Florida markets. And so when we looked at Gold Kidney, you approached us, you said, hey, Justin, you really got to take a look at this thing. And we were really surprised at what you guys are doing and how unique you are in the market. And me personally, I'm always looking for different ways to grow the book of business. And as an agent, you're always kind of figuring out like, okay, how do I differentiate myself out there versus every other agent out there? So can you talk a little bit about, Gold Kidney, and then you guys are positioned to be the king of C-SNPs, chronic special needs plans. Like, I love what you guys are doing there. So, if you could talk more about that.
Yeah. And I'll start kind of with how I came to be at Gold, because I think that's important to set the stage. So, we talked a little bit about our background, and I said I had to figure out how to start making a paycheck, and kind of fell into insurance, right? And so most of us don't wake up one day and say, you know what, I'm going to get into Medicare. But my dad was turning 65, and it seemed like everyone I was running into really needed help with their Medicare. It was super complicated, right? So I kind of delved in. I'd started in group insurance and then fell into the Medicare space. But the first plan I ever really got attached to was a chronic special needs plan. And it was so impactful, I thought, about how it was designed to truly meet the unique needs of the chronic conditions that we served at the time. So, like we talked about, I live in Georgia. We love our sweet tea. We love our fried foods here. So, you throw a rock, you don't have to throw it very far, and you find somebody with diabetes or, heart issues. And so it really became kind of my sweet spot to start selling C-SNPs. So fast forward 17 years, right? I've been at 2 large carriers. The last most of my career is spent at 2 large carriers. But when I got a call from our COO at Gold, he really sold me on this C-SNP approach, and that they were taking it back to the old days of truly designing these plans around the conditions of the people they serve. And what I love about it is it was actually started by 100 nephrologists. And so they came together and said, these are the benefits, right, that we really need in a plan to help people. And so I know kind of throughout the evolution of C-SNP, so many of the larger carriers kind of watered down, right? Their C-SNP plans, and it's hard to tell which is the C-SNP, what's their standard plan. It's more just a play to be able to sell through the year, but we really take it very seriously to make sure that our plans are designed for those with those unique needs. So it's been pretty cool to see the evolution of Gold here in that C-SNP space.
No, you're absolutely right. We've seen carriers come in as a secondary thought of like, oh, maybe we should have a chronic special needs plan, versus a carrier that's building your entire infrastructure around supporting chronic conditions. And just to kind of step back a second, in case we have some people that are new to chronic special needs plans, these are Medicare Advantage plans that have a contract with CMS, that they have come to CMS and say, hey, we're going to serve this subset of population that have this particular disease or particular chronic condition that's happening. So just want to make sure, and we're going to talk about different chronic conditions. So I just want to make sure that was like level set, because you and I, we can talk shop all day. Sometimes we're like, whoa. So, but yeah, so like obviously Medicare Advantage is exploding all over the country. You've picked, the 2 hot spots really, Florida and Arizona. We know where the seniors live, right? And that also includes the popularity, seeing D-SNPs explode over the last couple of years as well. For those, and D-SNP, by the way, is dual eligible special needs plans. So those are people that have both Medicare and Medicaid, which is another subset, right? But I think a lot of the times we overlook chronic condition plans and chronic C-SNPs. And again, there's, like you had mentioned, the carriers are coming into market to say, hey, maybe we'll just throw one of those in there, versus like actually building a company around it. So can you talk a little bit about like how you guys are positioned to attack the C-SNPs and that kind of growth that's happening across the country?
Yeah, no, that's a great point. So let's kind of start with, to your point, like what is C-SNP, and how do we serve all these different populations? So today, CMS recognizes 15 conditions that you can build a plan around, right? And that ranges from HIV, COPD, ESRD, stroke, all these things. But the most common conditions and the most common types of chronic special needs plans, right, are diabetes, chronic heart failure, and cardiovascular disease.
Right.
And it's crazy. So many people think, oh, this is such a little niche product. But 32 million Medicare eligibles actually have either diabetes, cardiovascular disease, or CHF.
Wow. 32 million?
Yeah. So that's like half of the overall Medicare eligible market. And the other insane thing is, and I started really digging into this when I started working at Gold, is only 1.1 million of those are enrolled in a C-SNP today.
Wow. So only 1.1 million of those out of those 32 million actually have a C-SNP plan, but they qualify.
They qualify.
Wow.
So talk about a way to grow your book of business. It's an amazing opportunity that we're kind of fronted with at the moment. So, when you also think about adding ESRD into the mix, only about 1% of Medicare eligibles with kidney failure are enrolled in a C-SNP. designed, especially for them. And that's so important for that. So as you can, as I kind of said, like, we're not really a niche. We are truly, if you look into your book of business, you're going to find a ton of people that have one of these conditions that qualify, right? And when you start digging into our benefits, you're going to find that our benefits are truly designed to help those folks. So when you think about them, they go to the doctor a lot. They go to the specialists a lot. Well, all of our plans for this year, they have 0 copay for the specialists they see the most. So you think about a nephrologist, endocrinologist, cardiologist, those types of specialists, 0 specialist copay. Next year, we're actually going to add another specialist to that list. So that's exciting.
Wow.
But we also offer food benefits. That's so important. Transportation, on our dialysis plan, 0 copay for dialysis. When those nephrologists came together, the 3 barriers to folks was cost of care, getting to doctor's appointments and dialysis, and then making sure they had healthy food even available to them. We have a great story from one of our nephrologists about how our benefits actually helped one of his patients. So it's called EFRG. It's how they rate how well your kidney function is working. And so when this patient came into the doctor, his EFRG had actually improved, which typically you never see. Yeah. So the nephrologist said, oh, tell me what you're doing. I want to tell the other patients about this, right? How did you improve this? And he said, the only change I've made is I now have access to healthy food because I'm on Gold Kidney and they're giving me these credits every month. So what a powerful statement. So we have the biggest fan in that doctor now, of course, but that's truly how we're thinking about building our benefits and making sure care is accessible.
Amazing. I mean, I got in the business by accident. I think most insurance agents do, right? Or they're forced by their parents or whatever. But what really kept me in the game was the impact you have on people's lives, and that's powerful. It goes long before money. But let's kind of shift gears to the agent really quick, because this all sounds great, but what's in it for me, right? So as a chronic special needs plan, just us talking right now, there's 2 major opportunities. Obviously network is one, so I'll throw that hint to you there. And then when can these people enroll if they have a chronic condition plan? What does that mean to an agent?
Great question. So that's another awesome thing about selling C-SNP. You never stop. You can go year round. This is one of the few opportunities you literally have to enroll somebody every single month throughout the year. And you and I both know, being in the industry, there is a ton of regulation that's coming down, right? Around specifically how D-SNP social election periods are going to work going into 25. And if that's your focus, that's going to be a tough market right now. Things are going to be changing really drastically. And so if you want to stay busy and you're not just an AEP agent, C-SNP's where it's at. You can sell it every month. In fact, when I was an agent selling C-SNP, a lot of times my 2-1s through 12-1s, I actually sold more in that period, right, than I did in AEP. And I stayed pretty busy in AEP. So that is one of the really, really great things when you think about being an agent. And then one thing we haven't talked about all that much, but again, with the different changes in the final rule, we're going to continue to be able to pay for our HRAs. Yeah. And our HRAs are actually significantly higher for our C-SNP and dialysis plans. And the reason we did that is we know it's going to take maybe a little bit more time with that person because they do have more chronic conditions. And we want to make sure we have really a full picture of that person as they come on board, so we can really set them up for the best experience possible. So for our C-SNP plans, we're paying $300 for our HRA. Dialysis plans are $400. So that's continuing for 25. So every single month, you have a great opportunity out there.
So can you talk also on the opportunity of the network that you guys have? Because as an agent, I think most people go to the PCP and they're like, hey, I work with a doctor, but they're not really talking about these other specialists Can you tap on that for a sec?
Yes, for sure. So we have developed special relationships with some nephrologists in both of our markets. And Desert Kidney Associates out in Arizona are one of them. Lots of opportunity in those offices. And then National Kidney Providers in Florida, NKP, is a really special nephrologist group to us in Florida. However, our network is very broad with nephrologists and our specialists. We're continuing to grow every day. It's, you know, if you looked at us back in January 24 or even before that, and you said, oh man, I don't see these doctors in, look again, because we truly, it's not just a saying, we are adding them every day. Really cool. We just added Cleveland Clinic, got that contract signed. We're really close with some big hospital systems and provider groups in Florida that we believe will be on by AEP. So again, if that's kind of, you've shied away because of that in the past, don't let that bother you. The other thing that's really special about our plans is even though we're an HMO point of service. And so what does that mean? A lot of times when you think about a point of service, you might be able to get some benefits out of network, but they're going to be at a higher cost. Our point of service is created differently. Our point of service, you can get all of your core medical benefits out of network at the same cost as in network. So if you need to travel or go to, you know, a specialist that's not in network, as long as they're willing to bill us, you can go to them and you can say with confidence that we're going to pay at 100% of Medicare. So it gives you a lot of flexibility there as well.
So I'm making a note because you brought something up. I want to make sure I touch on it later on. But okay, so getting into some of the technicals here, you know, you guys probably have, if not the only plan that focuses on ESRD, but there's a couple other plans that have chronic kidney disease, and there's a difference there. But before we go into that difference, I want to talk about, you know, when I was an agent, this was, you know, back in the day, if you came across anybody that had any type of kidney situation, you were told to like leave them alone, get out of there, don't mess with them, and you move on. And I probably walked away from hundreds of people that I could have helped with Gold Kidney in my heyday. And I feel terrible, and I hope that we can find them again. You know what I mean? But and we'll come back to this later because I have a realization, because most people and most agents are still doing that, which means that these folks are probably still on original Medicare, and that makes a difference in your commission. So we'll talk about that because that's a big thing too, right?
For sure.
But can you talk about, you know, chronic kidney disease, what that is, and how you guys are kind of approaching that with the market?
Great question. So again, before I started Gold Kidney, or, you know, at Gold Kidney, if you asked me about the kidneys, I wouldn't have been able to tell you very much. You know, it's like kidneys, I think they're back here in my back.
Yeah, I got two of them, I think.
I got two of them. But so we refer to it as CKD, chronic kidney disease, and we are truly focused on kidney health. And I'll tell you, you know, a few reasons why, and I'm going to quote some statistics, but a little over 1 in 3 adults are at risk for kidney disease, and most don't know it. That's like really the scariest fact. 38% of all Medicare eligibles have chronic kidney disease. And this is one of the main reasons we've really zeroed in on kidney health, because it's a major yet silent threat to our aging population. And really, unlike any other conditions, it typically doesn't show any clear symptoms. So it can be really sneaky, and you can end up really damaging your kidneys over many years without you even realizing it. The CDC has a stat that up to 90% of people with chronic kidney disease in the US don't even know that they have it. And really, given that kidney function starts declining with age, it's crazy, this statistic, but it's almost like 1% after the age of 40. So I was a little over 40 when I started here. And so that was a big wake up call to me, but it declines over time. So by focusing on this, we think we can step in, hopefully slow the progression and even prevent it from progressing to, you know, several of the stages. So we're really, you know, passionate about shining light on the silent killer, truly, because we see a chance to dramatically improve the quality of life and the outcomes for this large segment of folks. The other thing that I didn't mention when we started talking about C-SNP conditions, what's really interesting is for 2026, chronic kidney disease is actually going to be one of those conditions too. So today we have plans built around the diabetes and heart conditions, just because so much of that population, and those are really precursors to CKD, or typically if you have CKD, you have one of these conditions. So it's easy for us to build a plan around that and still focus on the kidneys. But for 26, I think we're really uniquely positioned in the marketplace to take advantage of that new condition coming online.
Yeah, it's interesting because I think at first people look at gold kidney like, what are they doing? They're just going after ESRD and kidneys. Like, there's not a lot of people in that market, but it's obvious you guys have done the research. You're looking at the CMS numbers. You're looking at the Medicare people, and you have decided, like, this is how we're going to come at the game. And it's really, really interesting to know that the numbers are that big.
Yeah.
I mean, yes, you might be a small company today, but you're going after a massive market that I think every other carrier is kind of ignoring, or has been really afraid of getting into it because of the cost. We know it's not easy taking care of these patients.
Right.
Yeah.
Right. And I think that's why we're uniquely positioned too, is because this is our focus.
Right.
If you think about large carriers and where I've been before, they were just trying to capture as much of the marketplace as absolutely possible. So a lot of the benefits end up becoming a little vanilla because you're just trying to appeal to the masses.
Right.
We're trying to really zone in on what appeals to these folks, and also what are the benefits that are going to keep them the healthiest, because that's truly what it's about. And for our bottom line, that's what it's about. We got to keep these folks as healthy as possible. And to your point, when we were just talking about how many people, right, have all these conditions, and we talked about CKD, but like, diabetes and these heart problems add to the CKD. 1 in 4 people over 65 have diabetes. 70 to 75% of people between the ages of 60 and 79 have a cardiovascular disease. So again, like, this population is huge, and all of these people are at risk for chronic kidney disease. So how cool would it be if you're an agent? I know when I was an agent, you start looking at all the prescriptions and you become a little bit of a medical expert yourself. But how cool would it be to be able to go into somebody's home and say, here's why gold kidney could fit you. And let me tell you how important your kidneys are, right? They're really one of the biggest things that show you the health, like, right? Like, if your kidneys are not working, everything in your body's not working. Your heart's not going to work. Your lungs aren't going to work. All of these things start failing. So I think that's another value that you can really bring as an agent, and people appreciate that, right? If you can teach them something that they didn't know and really show that you're looking out for their best interest, I know that's when I made the most impact as an agent myself.
Yeah, that's awesome. So yeah, I mean, it's obvious that the kidneys play an integral part in the entire health system, right? You said it ties into diabetes, it ties into heart disease. So it makes a lot of sense why you guys are focusing on that particular chronic condition with the kidneys. But what I've learned recently is that you have chronic kidney disease, and then you have end-stage renal disease, which is different. And I think a lot of agents kind of confuse the two. So could you kind of lay out the differences between the two?
Yes. Great question, and great thing to point out, because I think I was probably under that assumption too when I started with gold kidney. Is like, well, if you have chronic kidney disease, you're on dialysis. No.
Yeah.
There's 5 different stages to chronic kidney disease. And as we talked about, it typically takes a little time for somebody to even find out they have CKD. So most people aren't even told that they have any issues until they're in what they call stage 3B. So without proper care and the progression, that is going to progress to dialysis, but it can be slowed. Typically can't be reversed, but it can be slowed. And that again goes back to our mission. Now, once somebody reaches stage 5, that's called end-stage renal disease, or ESRD. And that's when typically people need to go on dialysis and or looking for a transplant, which is something pretty neat too that we're going to be rolling out for 2025, some special benefits for those with a transplant. We have the Centers of Excellence in our network for transplants. That includes Mayo. So we're a huge proponent of transplants, and we've actually already had multiple successful transplants, even though we're a relatively small plan. So, but ESRD can affect people at all ages too. And this is one of the ways you can actually qualify for Medicare prior to age 65.
Yep.
So again, at stage 5, that's when you need dialysis. It's interesting too, because most of the studies show that people kind of say they crash into dialysis. And that means that they're starting dialysis in an unplanned way. Typically they're going to the emergency room and being told that their kidneys are failing. And there's no real main symptom. It's just a lot of times they just complain of not feeling well. So again, we want to really bring education to this. And we want to make sure that we're slowing that progression and removing any of the barriers to care that folks need to make sure that progression is slow. So it's really quite an interesting take on the model of care.
Yeah, I mean, it is because if you've ever seen anybody that's going through dialysis, it's not an easy lifestyle. So you're right, like they have to completely shift everything in their life. And, like you said, they find out by accident. They probably don't have a doctor. The ER doesn't care because they got 500 people behind them and there's no coordination, right? So that brings me to like, how Gold Kidney, how can you guys change this? What benefits do you guys have, or what functionalities and infrastructures do you have when we bump into somebody that has ESRD and we're like, look, we need to get you out of this funk that you're in, and we need to get you into a plan that's going to get you what you need. So can you talk about the benefits of joining Gold Kidney, both like from a holistic approach and then maybe some like, details as far as how it would help the member?
Yeah, for sure. So, gosh, there's so much. Where do I start?
Yeah.
Well, I'll start with the kind of model of care. So we have care coordination and care models that we have, and we have partners that we work with too. One of our partners is Duo. We have a few different that we work with, but Duo is really unique because they have this pod model, and they really are in the home and local. So if you think about the programs like house calls, I always say this is kind of house calls on steroids, because you've got a nurse practitioner, you've got a care coordinator, and a social worker all at your fingertips. And they really develop this pod around them. So they're making sure they have access to care, and they're accessing the benefits that they've signed up through Gold. So that's one way. We also do a lot of care coordination internally. We have an awesome clinical ops team. Kirsten's our VP of clinical ops, and that's how I've learned so much about kidney care. She has really provided quite the education. She worked at a dialysis facility for a long time as a nurse, so that's pretty neat. But as far as like benefits go, I mentioned the zero copay for dialysis, the unlimited transportation. So many of these things, when you kind of package them all up, and we've tried to compare to other plans in the market, we believe that somebody on dialysis is going to save somewhere between $5,000 and $9,000 a year on our plans. And our plans, you save significant amount too. And the big thing is drug costs, right? And we know drug costs is going to change drastically next year. But if you think about the population that you have in your book of business today, if they fit into any of these categories, likely they're in the coverage gap, right? They're in the donut hole. And what's so scary about that is drugs that they need access to, like Farxiga. Farxiga is a big drug that helps with the progression of kidney disease. Again, most of these people have diabetes, right? So you start thinking about like Ozempic, Jardiance, Trulicity. All these drugs are super expensive. And you know that if you're an agent and you know that they're going into the coverage gap, they've probably been in the coverage gap since April, right?
Oh, yeah.
Hundreds, if not thousands of dollars for their prescriptions right now. It's crazy. And most of the doctors will say, I don't even, I know this is the best drug out there, but I can't prescribe it because I know the person won't continue to take it, or they come back into the doctor and said, I just can't afford this anymore. What's really neat about the way we've designed our drug benefits for 24 is when somebody goes into that coverage gap, those drugs actually drop in cost. They go down to $12 a month. And in fact, if you do mail order, you can get a 100-day supply for $12.
Wow.
Got somebody on any of those meds that I mentioned, and we've got a whole list of them, but Farxiga is a big one. Again, Ozempic, Mounjaro, Trulicity, Jardiance, all of those and more. Those drugs are going to go down to $12. So what a superhero the agent could be today, right? If you're listening to this, and there's somebody in their book of business that they've had, like I said, my husband, got his license at the beginning of this, and he had a new member just call him and was saying, like, I just can't afford these drugs anymore. What am I supposed to do? And we're not in Georgia yet, so I couldn't help it. He said, I don't know. And he gave them some resources, right? But unfortunately, this person was in the coverage gap, and they were practically in tears. I love to also share, I'm going to share one more story about how impactful that specific benefit is. As I mentioned, we work with nephrologists quite a bit, and we have an opportunity for agents to even sit in some of their offices and
awesome.
And do tabletops. And one of our agents was sitting in an office one day, and we had a sign up behind it said, get your Trulicity and Ozempic as low as $12. Comes up and says, how can I do that? The agent starts talking to him. The person starts crying.
Wow.
And said, my wife and I were talking about getting a divorce because I cannot afford my medication anymore, and I can't qualify for extra help.
Right.
This is going to save our marriage. And I said, well, that's not every day that we can save somebody's marriage, right? But they were just over the moon that this was really going to have such a major impact in their own life, right? So be able to save your clients significant amount of money by just that one benefit alone. Again, I could go on and on and on. We've got pop-up pals that is huge, again, for the folks that are on dialysis, because a lot of caregiver hasn't been able to leave. We've had about that. Like, I haven't been able to leave my husband alone in literally months because I'm caretaking for him all the time. Pop-up pals, wow, we're having them come in. I can go to the grocery store. I can go get my nails done, So it really is changing the way people live and the way they view their own health.
Yeah, and the pop-up house too. If you're a new mom or a new dad, you get it. You need a reprieve. So, right, like you feel like you're stuck with the kids, but in the reverse, right? So I get it. That's a huge benefit. So we talked about like what happens when somebody gets ESRD, and you guys are there to kind of catch them and really take care of them. But let's talk about prevention, because that's really the name of the game in Medicare Advantage specifically. And maybe there's people that are coming in that might have stage 1 or maybe some symptoms leading into chronic kidney disease. What benefits do you guys have on the preventive side, or what are you guys doing as a company to say, hey, let's try to keep this member from going to level 2 or level 3 when it comes to the disease in those stages?
Yeah, for sure. So that brings me to a great point. We actually do have standard non-SNP Medicare Advantage plans too, because a lot of times if you are in stage 1 or stage 2, you may not have any of those other conditions. So we do have our standard MA plans. We're going to be calling them Gold Advantage for 2025. We've kind of tried to simplify our names a little bit, but really strong benefits. So we truly want to make sure that they're staying as healthy as possible. So not only are we kind of loading up those core benefits, you're going to see low maximum out of pockets. Today, even on our standard plans, we've got the 0 to the specialist for those key specialists that we talked about. And on our standard plans, it was really unbelievable. When I came in, I'm like, these are our standard plans. They're really, really good here.
Oh, okay.
So our drug coverage is still spectacular. We have enhanced formularies even on our standard plans. But when you start thinking about, we've got fitness, we've got the personal emergency response system, and our personal emergency response system is a little different than a lot. It's more of a true system to make sure you're connected to your doctors and transportation. If you attend one of our kickoffs, you'll hear all about it. The first time I heard about our personal emergency response, I was like, I think they're wrong. There's no way they do all that. So that's been pretty cool. We also have a flex card. So we've got our vision, dental, hearing is an allowance. It's all loaded on just one card. They can go to anyone they want. They use it like a debit card. Here you go. That allowance is loaded on there. We've got groceries. Next year, we've got some really, really cool benefits that I can't quite talk about because this might end up making it out into the general population. But you're going to be, I'll say, really impressed with some of the gold perks that we're going to be able to put out on even our standard plan to make sure that they're having access to healthy living and fitness, and things that you just truly need to keep you healthy, right?
Yeah. And we're going to talk about that because I might get you to spill the beans on a couple of things here because we're close enough, right? Like, we're real close.
In trouble, Justin.
Okay. Well, we know, 2025 is obviously a very disruptive year. We've seen CMS come really hard at agents and FMOs and started creating it, all of these rules and regs, and then they came after you guys at the health plan level. And so we're seeing the health plans, we're seeing the reimbursement rates kind of, take a step back, and we're seeing big carriers exiting markets already. We're seeing health plans just shutting down Medicare Advantage completely and moving into different segments. And we're seeing a lot of disruption. And one of the big boys has announced that they're leaving markets that will impact almost 250,000 people across the country. And you're looking at this and there's like, this is massive disruption that we've never seen before. And we're already hearing reports of like, a typical year, seniors go out and shop, 20 to 30% of seniors will go out and shop, not necessarily buy, but 20 to 30 will go out and look at the plans and everything. This year, they're expecting over 85% of seniors are going to go out looking for plans. So this is great. This is like, it almost makes me want to hang it up and like go back out and sell, because like, this is like going to be the biggest hunting season we've ever seen, in my opinion. So, can you talk about how you guys are digesting all of these these changes in the market? And then as a health plan, what's your position and where are you going with all of this that for 2025?
Yeah, Justin, it's going to be a wild ride, I think, this AEP. Yeah. But we are seeing 2025 AEP really setting up to be an incredible opportunity for us. So we've doubled down. We've said we believe that providing these core benefits to people are going to keep them healthier, keep them on the plan, keep them happy, keep them from calling you agent, complaining, I'm having to pay now a deductible, because that's going to happen, right? We've seen, I know you guys have seen first looks. We've seen first looks. Almost all the plans I'm seeing have now a deductible on Part D, right? Like at least some tier. Think about just AEP is a huge opportunity, but think about your phone ringing on January 15th when they go and pick up that first prescription and they're asked to pay $400-$500.
Yep.
That's not going to be a very good experience, right? That's not going to be very much fun. Yep. On our plans, I can tell you, we will not have deductibles on our prescription drug coverage. Awesome. So huge benefit. But again, we're really doubling down this year. We're not expanding states, but we are expanding counties. And so we're doubling our footprint in both states, Arizona and Florida. We're going from, I believe it's 9 counties today in Florida. We'll have 22 for 25. And then we are in 4 counties in Arizona, and we're going to be in 8 in Arizona. It's really pretty cool. We're moving into some of the rural areas, and we did a first look the other day, and this agent asked if we're going to be in Navajo, and yeah, we're going to be out there this year. She almost started crying. I've never seen so many people cry, tears of happiness.
Yeah.
been in this job. And it really does. It like makes
Yeah.
you just so energized and like you're really actually helping people. And sometimes, you know, in this world, we can get a little jaded, right? But she said,
Totally.
oh my gosh, in this rural market, there is nobody there. There's nobody there that will help these people. I'm pulling up my spreadsheet right now. I've got a list that I'm going through as soon as 10-1 hits. So we're really doubling down with expansion. You know, we talked about the network. We're growing our network substantially. It's really amazing that the quick work our network team has been able to do. We believe, and our network team might get mad at me for sharing some of this stuff, but we believe we're basically days away from having Tampa General in network.
Wow.
USPNs, we believe, will be in network by AEP. Moffitt will be in network.
Wow. That's a big one.
We're that close with Honor Care out in Arizona. So, you know, most of these, we all have rates agreed to. That's the hardest part, is getting through that rate conversation. And now it's just the contracting piece. So I'm calling our network lead, Carrie, every day. Did we get it? Did we get it? Did we get it right?
Yeah.
So check your emails if you're contracted with us. As soon as they're signed, we're blasting it out. We're working hard to get them credentialed and in our Find a Provider tool, which is improving for 2025 as well. But yeah, so I just can't say how excited we are about the opportunity for 2025. We're hearing quite the buzz in the marketplace. And again, we're going to have some super innovative benefits 2025 in our C-SNP and dialysis plans. I've been told no one else in our two markets have. So I will also say we're really working hard to make sure that benefit connects your customer, our member, back to you. And so I know when I was an agent, that was one of the biggest things, right? Is like, you got pretty quickly turned off of a carrier if they didn't seem to be taking care of you or you know, stealing your business, right? We heard that a lot. They're trying to steal my business.
Yep.
You really want to make sure the agent stays in the loop and stays in front of that consumer if they need something, right? We're going to have our customer service right front and center, but we're also making sure that we close the loop back to the agent. So it's a really cool benefit. Make sure you come out and check us out if you want to hear more about it.
Oh yeah, we've got rollouts on our calendar. We're promoting them. Get out there and see those benefits. And one of the things that you alluded to earlier in our conversation was, you know, you're expanding in different ways. Obviously territory, obviously benefits, plan design. So you guys have core plans. I think a lot of the agents are going to say, oh, they're a C-SNP plan or they're a D-SNP plan, and that's all I'm really like in my mind thinking about. Can you talk about making sure that the agents keep you guys, you know, top of mind for the core plans as well?
Sure. So we'll have what we call our Gold Advantage, which again is our non-SNP. It's funny, somebody said, I've never heard it talked about as non-SNP. I said, I don't know how else to describe it in our world, but standard plans, core plans, however you want to say it. But Gold Advantage is our MAPD. And then we're going to have Loyalty Care, which is our MA only plan. Both of those plans will have Part B givebacks, really strong Part B givebacks, especially in Florida. So take a look at that. But yeah, I mean, really robust benefits even for our non-SNP, because again, we know that kidney health, like when they hit 65, they're going to be stage 1, stage 2. Unfortunately, we probably are too, but we want to keep them as healthy as possible. So we've got great options for those folks as well. Again, if the give back's important to them, we've got that. Another thing, like with the MA only Loyalty Care, obviously a lot of folks focus on veterans. I mean, talk about kidney care with veterans, that's super important, but we've also really made sure to enrich like the dental vision hearing allowance, because we know that's so important. And then like even things like Papa Pals, right? They really view that as super important. We're going to be changing up some of the transportation even on some of our plans, and just really offering a full package of things that they can access care, but also enrich their lives.
Awesome. And so I got some I wasn't able to make your kickoff because my daughter was born, and I felt like I needed a Papa Pal, but so I didn't make it this year. But I got some recon on some of the stuff that you're doing on the benefits. Am I allowed to like ask about this stuff? Because there was one benefit, and I'm going to do this. Am I allowed to ask about this?
Well, we'll talk about this. We'll talk about this. So
okay. Okay, cool. So I heard you guys are working out something where you can give your seniors a cell phone. Like, is this a thing? Like, this is crazy. So can you talk to me about this? Because no one else is doing this. And let me tell you, in Florida, we used to have agents that would link together with SafeLink, which was like a free cell phone service for those in need. But you had to qualify it with like food stamps or cash assistance, or you had to be on Medicaid. So it was a little bit harder to get. But we would have lines and lines of seniors, which was an awesome opportunity. We had people grow their book of business very fast in that market. But if this is back, like, this is a huge marketing opportunity. So can you talk about, what you guys are doing there?
Well, and I'll give my disclaimer so our compliance folks don't get mad at me. This is for broker intent, broker use only. No consumer. If you're a consumer, you should stop listening now. But yeah, we are going to be rolling out a free cell phone, and that's unlimited talk, unlimited data, unlimited text. It's the coolest benefit I've seen, and it's interesting. We have built such a cool, I think, a cool team here at Gold Kidney. So our new CFO came to us from another, the big mammoth, and the first day I met him, he said, I have a benefit I want to put on our plans. I couldn't get them to bite on it. I think we can be the first to market with it. And it was a cell phone benefit.
Wow.
And he started telling me about all these things that we could do with the cell phone.
Mm-hmm.
It's unbelievable, all the capabilities that not only do they have this benefit now, so this will be on all of our C-SNP plans and our dialysis plans. So you do have to have a chronic condition, you have to qualify that way. But again, to your point, if you could get a phone for some population, typically it was only Medicaid, right? And that was it, really. This has no Medicaid qualification. It's truly for our C-SNP. And so I think it's going to be a huge differentiator. And that's where I was kind of talking about. We're working with our IT teams and their IT teams right now to figure out what's going to be loaded on that. We know we're going to have our member portal. We're going to have a few different apps loaded on there. They can push widgets to them every day so they can have reminders. But we're working really hard to make sure their AOR is loaded in the phone. So our customer service will be loaded in the phone, but the AOR too. So if they forgot to save your phone number, at the point of sale, now you'll be in there, which I think's really going to set us apart as well. So yeah,
you're gluing them to us, which is, you can't get any better. But like, thinking about the experiences that I've had, some of these seniors are choosing meds over groceries, so they may not be able to have their cell phone. And then we've also seen a situation where they do have one of those, they'll call them Obamacare phones or whatever, but they run out of minutes, right? And then what happens? Then they have no phone. They have no way to reach out. If they have, luckily the emergency services work on there, but they can't call their doctor. They can't get appointments. They can't get rides. They can't even reach their health plan. So, they become very isolated. So you guys providing a cell phone not only opens up, their world of care, but also just this immense, I think, relief for them to know that they have a constant connection with their their health team. So I commend you guys for that. It's huge.
Well, and that's a great point, because a lot of people are like, how are you able to offer this? There's so much scrutiny around these extra benefits now, but that's exactly the point. You have to prove that it ties back to their healthcare. And these people are, to your point, they're choosing to pay either their $70 cell phone bill, right, or get $70 worth of food on their table. They're not paying it, so you can't, their phone's disconnected all the time, or they run out of their minutes. How can you be diligent about reaching out to them, making sure that, like I mentioned, one of our partners, Duo, that's the biggest issue, right? Is getting actually in touch with these members. Now we've taken that away. We can get in touch with them now. So it's pretty cool. There's going to be little surveys on there too to, kind of ask them how they're feeling each day.
Oh,
and
cool.
So we're going to be able to really make sure that we're meeting them where they need to be met. And if there is something that we're intervening quickly and making sure that they get the care they need and they're not crashing into the emergency room, right?
Yeah, brilliant, brilliant. All right, last thing here, and probably the most important is a note that I wrote. Let's talk about commissions, right? And so, commissions are improving for 2025 for Medicare Advantage. You guys are keeping up with fair market value, I'm assuming.
Yes.
You go to the top of it. So that means, just thinking about this, and what we alluded to earlier in the call is those people that you find on ESRD or maybe chronic kidney disease, typically these people are on original Medicare, right? And so what does that mean for an agent? If you enroll somebody in Gold Kidney that is coming off of original Medicare, that's a new to Medicare rate, right? And so for 2025, it's almost $700 for new to Medicare. If I calculated that right, I mean, it's that
like 626 or something, but yeah, like it's significant. Yeah.
Yeah, huge, right? And then you guys are tapping in a potential extra $400 for just doing that HRA, which, by the way, you can do at the point of sale, right?
Yes. 100%.
Get that done. I think it takes 10 minutes or less.
Yeah, it's
to
not
get it done. You make $400. You're making over $1,000 in helping somebody connect with Gold Kidney and doing that HRA. I mean, give me 10 of those a month, Lee. Give me 10 of those a month. Like, I'm done. I'm sitting on the beach. Give me 10 of those a month, right?
Listen, Justin, don't tip me. I've definitely thought about like, I can get my running shoes back out and
That's
hit
what I'm
the
saying.
yeah. But yeah, we want to make sure we're really drawing attention to this population because not enough agents focus on it. We know it's a little harder to find too.
Yep.
So we want to make sure that they're able to spend the time with these folks and get rewarded for it and just paid for their time, right? I mean, that's what it's about. When you're an agent, your time's money. So whenever I spend time with agents, I tell them, thank you for investing in me, right? Thank you for investing in Gold because your time is money. And that's really how you have to think about it. So, but yeah, the economics are pretty good. The other thing that I would add in, we have local teams in both markets. We've got sales directors, we've got market managers, and we have a really cool role called a PACER. And of course, in our business, we got to keep coming up with crazy acronyms, but it's a provider and community engagement rep. Really what that role is meant to do is provide agents with opportunities. So we want to pull them together. So if you're thinking like, gosh, how do I actually have some community opportunities, but I need a little extra support and help. How can I get that? We're here for you. Or if you're like, I want to get more engaged with that in my community, reach out. We'll get you with a PACER. Trust me, they've got tons of opportunity. They're setting up events every day. We'll get you plugged in there. So really all the way around, we want to make sure that we are easy to do business with and we're supporting you as an agent.
Yeah, I mean, having strategies, the money's there. You've got a killer plan with crazy awesome benefits. You're expanding. You're looking at the big picture, but you're also focused on a select subset of folks that really need your help. So I think you guys are cruising on cloud 9 here. Last question: are you guys taking new agents? Can we get contracted with you guys?
Well, I guess. Listen, no, for sure.
Awesome.
We are so excited to be continuing to expand. Come get certified with us. Get ready to sell with us. I promise our certifications are easy. Last year, I touted that they were the easiest in the market because I actually, when I walked in the first day to Gold Kidney, I said, okay, it's June 1st. This is last year, right? Where are our certifications? And they're like, well, I think you're doing them.
Oh, okay.
That's how small it was. That's how small we were at the time. And so
Awesome.
They were the easiest in the market. I will still say I'll put ours up against anybody. I think they're still some of the easiest in the market. You're going to learn a little bit about C-SNP this year, which I think is really important, right? Because again, I think agents get scared. I think that's one of the reasons maybe they've shied away from C-SNP in the past because they just aren't sure what else do I have to do, right? With this. But it's super simple. Again, if you just look in your book of business, you're going to find folks that qualify for these plans. There's just no doubt. So come get ready to sell with us. Come to a training. I think you'll be wowed. Even when we've had some, there's always those agents that are naysayers, right? Yeah. When they really hear the full package of what we're offering, right? It's not just about the money to the agent. It's
Right.
not just about the benefits we're offering, even though, you know, we can save up to $9,000 for a dialysis person. It's truly the whole package that we're offering.
Yeah, and I think you know, as agents, you're like, well, this is a new plan. Let me see how it goes. You know, you're always very cautious with that, and I get it because you know, us as agents, we've been burned in the past. But first of all, I'll say that incredible leadership. You know, Lee's been in the game for a long time, and her coworkers over there at Gold Kidney are also legendary as far as where they've come from and what they've built. So this company is not going anywhere. They're solid. You guys got you're backed. You've got a great game plan, and you've been very generous with your offerings to both the members and the agents. So we're excited to offer you guys. So if you're not currently contracted with Gold Kidney right now, call us at Healthline Markets, 844-696-3975. We'll get you set up, or you can send an email to contracting@askhpm.com and we'll get you set up. Just reach out to any HPM team member and we'll make sure to connect you. From what I've seen, onboarding is super, super easy. Certifications are really easy. You guys are fast. You don't have a gajillion agents like flooding your system. And you're accepting contracts. And I asked that for a reason because some carriers are telling us that they're going to be shutting down early. We've seen that. And we saw it last year too, because they don't have the staff to do it or they just don't want the agents and the sales. So to know that you guys are saying, hey, come join us, let's go. This is big picture stuff.
Yeah. Yes. We want you. Come join our team. You'll feel the love. You'll feel the gold around you. You know, like our motto this year is go for the gold. So a lot of people aren't talking about growth this year. We're one of the few that are talking about growth. So come grow with us, and let's get after it.
Lee, this has been awesome. I learned a lot. It's always fun to talk to you. So thank you for your time today and putting this together for our team.
Hey, thank you, Justin. Really appreciate all of this and good luck this year. I know you guys are going to crush it. You've been amazing partners to Gold and we all truly appreciate it.
Oh, more to come. Thanks again.
All right. Thanks, Justin.